right, so for my presentation, I did choose aquatic therapy as my activity. Sorry, as my topic, and so aquatic therapy is used as an intervention for people who have a variety of disabilities and conditions. This type of therapy provides a fun and challenging experience for all ages. Many clients feel a better sense of self-esteem and accomplishment after being in an aquatic therapy session. The aquatic environment has potential of meeting goals that promote health and well-being as deemed essential by the World Health Organization. And most exercises used on land will work different muscles in the water. So, what I didn't know until reading about this specific intervention is that the therapist actually does the assessment on land. So they do perform it on land, and then in the water, they'll modify it to whatever the client's mobility is. So I did choose as my activity, I chose swimming. So swimming can be adapted to each participant's needs and capabilities while facilitating normal patterns of movement. It could provide an array of benefits that may reduce the burden associated with a variety of different disabilities. And it does encourage participants to achieve independent leisure and improve functioning and enhance their happiness. So, going back to enhance their happiness, not only for physical disabilities such as cerebral palsy or spina bifida or any of those, anyone who suffers from MS, but this can actually really enhance a person who has depression and who suffers from depression. So if they go to do, like, let's say a water aerobics class, which is a form of aquatic therapy, their happiness is going to be enhanced way more than if they just go do like another type of facilitation. The swimming really does, like, the water, there's something about the water that makes people just feel very free flowing, and especially if you're in a group of people that are also doing the same thing and let's say it's their first time, it makes them feel better, so it gives them a better experience as a whole. So instructions, they assess the client depending on their range of motion, mobility, and body coordination to perform specific tasks. Group or individual introduction. So if you're working with a group, you do a group introduction of everyone. Everyone says their name. If they don't know how to say their name, because some disabilities, they may be nonverbal. So the therapist will introduce everyone, and then if it's just one-on-one, they will just introduce themselves as well. And then next, depending on the client's assessment, therapists will use movement in the water and to develop body awareness. As a warm-up, stretching and increased mobility will be done first. Next, series of exercises that target specific areas the client needs improvement. So going back to what I was saying about the assessment, to assess the client depending on their range of motion and on all of that, they will determine what type of exercises that client does need improvement on and need to target on for that session, or just in general. And then every week, depending on how many times a week or how frequently they do go to therapy, is when they'll target other specific areas that they also need improvement on. And then lastly, cool down. So bring heart rate down, start relaxing after the exercises. So the equipment and environment needed. You need a pool, of course, water floats, paddles, life vest, foot weights, goggles, kickboard, walker, and water games. So over here, this is it's like a dumbbell. Well, this is a bigger one, but it's like a water dumbbell. These are the paddles, and then this is a specific vest that people with CP use, and as well autism, just to keep them afloat, which is really important. You'll see, like, in aquatic therapy, there are different types. There's swimming. There's also learning how to walk in the water. All of that has to do with aquatic therapy and swimming. So I think it's really interesting that you can walk with a walker in the water. I thought that was interesting. They do have water games, so with people or children with autism, water games is very good. Also using foot weights if you have cerebral palsy, that's really good to use on your feet just to build that mobility on your feet. And then life vests, of course, because everyone needs to stay afloat. We don't want anyone drowning there. And paddles just for any specific activities that the therapist wants to use. Also noted that the water cannot be hot. It has to be warm, and it can't be super cold either. So it has to be at a happy medium. Lukewarm is a lot better. So leadership, the therapist blends land-based skills development with that in water. So it affects of buoyancy of water on movement is considered. Also touch supervision. So touch supervision is just making sure, just always holding on, like making sure that the client is not drowning, hopefully. Just having that like touch also like just makes the client feel better that you're like there, you're really watching them. So that's really important. Using passive techniques, so upper extremity stretches, relaxation, and lower limb. Must be certified through ATRIC, Aquatic Therapy Rehabilitation Industry certification. So there is a specific certification that you do need to go through to instruct this and to be certified, for MS, for spina bifida, for like a whole bunch of other disabilities. So, and also the responsibilities is to make sure all participants have the equipment needed. So like I said, all the equipment, the provider obviously does need to provide that. And okay, so then for briefing, letting the client know what we will be doing, working on that day of service, expecting them to try their best while also overcoming challenges, and going over goals for that session for each individual. All right, and for lead, instruct the group or individual on what exercises they will be doing and demonstrating how to do it. Must also speak clearly and make sure clients are always safe. So write down progress notes to then discuss it in the next step. So for lead, when I said like speak clearly, there are some, there are going to be some clients that you may encounter that you need to really speak louder, especially if they have any hearing impairment or anything. You have to speak clearly, move your mouth very clearly so that they understand what you're saying. And as well, like demonstrating them how to do it is so important because they will mimic you. So that's important to mirror you and all of that. For a debrief, talk about how the clients feel, what the activity did for them, and make it a fun end by everyone sharing something they liked during that session. So I chose that because I think that coming to an end, you want to discuss everything, but you also want to make it fun and interactive so that they're not just, they're just like, okay, well, we're done, bye. It could be more interactive like that. So for cerebral palsy, I chose this as one of my disabilities. Adaptations, soothing music. I actually did some research, and I would have never thought this, but soothing music while like having a session makes them feel much like very like spa music, something like that. I found that very interesting. Floating assistance. So as you can see in the picture, she does have one of those floating one of those floats that I mentioned earlier, and in back of her are the dumbbells. And then there is a chair lift that gets you in and out of the water. So specifically for cerebral palsy, they may not have so much mobility in their legs, so that is also very helpful. And like I said, there is a water walker that will help them walk better, and in the water it's a lot easier for them. So this is like a really, really great facilitation technique to have. And then just like a tidbit, gravity causes individuals exercising on land to experience greater joint loading and weight bearing requirements compared to exercising in the water. So I did provide a video just so you can have a visual representation. And it's right here, so let me see.
Because all my stiffness, all my tightness was gone.
He deals with a lot of spasticity and contractures, and so being able to work his muscle tissue and his muscle fibers, it allows him to take a pause in his body, and it allows me to then lengthen his muscle tone and being able to give him that range of motion that he is lacking.
With my muscles tightening up and tense up. When they tense up, it's hard for me to talk and to walk, and it's hard to do anything.
The session with Donnie was aquatic thermal massage, and that is taking therapeutic and clinical massage therapy to the water. I was working with deep tissue and neuromuscular techniques for his cerebral palsy. Donnie comes into our facility and places his wheelchair to our manual lift. A lifeguard assists him into the water. Then I begin working the muscles in the back of his neck, along the front of his neck, out his shoulders, increasing range of motion in both his neck and head, and then working down into his shoulders, ultimately into his arms, allowing that range of motion to give him where he can raise his arm up and over his head.
You can take a palm of her hand and mash on my muscles and on the pressure points.
Once I've worked both of his arms, then I'll move down to his legs and then into his feet.
Well, I can move better since I got with Wendy. I can do so much better.
One of the things that he shared with me, he was able to lift his arm and put deodorant on. And I know that seems simple, but to be able to raise your arm and lift and get things out of a cabinet, by doing this type of work with him, he has gotten a larger sense of independence.
I feel so relaxed. I've never been so relaxed before.
So I thought that was super nice to see. That's a really good visual representation of how much cerebral palsy clients do benefit from this, especially like he was saying, the tightening. So now he's stretching. That is a really, really important thing, and you can see that he felt more he had more confidence, and he felt more relaxed. That he kept emphasizing. So that's wonderful. So I also chose autism spectrum disorder, so ASD. ASD, and so I chose specifically children. So some adaptations, assistance with floating by using a specific floater. So the same one that you see for CP can also be, there's like a similar one that you can use for children and adults to use. Using picture cues to explain and show the child what the therapist is asking them to do. And also the therapist must evaluate the water temperature and the distractions. Therapists will use movement in the water to facilitate sensory integration and picture exchange communication system, which is also known as PECS. So like I was saying, to using picture cues to explain and show the child what the therapist is asking them to do. I've seen a couple of videos, and in my research, I did see that this is a very effective way. So showing them, what you want them to do, it's very highly that they will do it. They will understand what you're saying, and they will try to mimic the picture and do exactly what is being told. And then also when it said the therapist must evaluate the water temperature, so back to what I was saying before, the water temperature does have to be warm, not super hot, not super cold, but it does have to be warm, just so that they're very children and adults with ASD are very, hypersensitive. So anything like that can distract them as well. And of course, also, like, I thought was really interesting, as you see in the picture here, he does have like a bucket and all of that there. That is also, you can do some games. You can play some games so that they also use their fine motor skills while being in the pool. And I also researched here in Miami, there is a place called Little Swimmers. I actually have been there. I volunteered there before through a school for children with disabilities, and we have taken them there, and they had a blast. So I think that like now, like seeing it in retrospect, it was very fun. The children had so much fun. We actually got to go in the pool also, so it was so much fun, and you can see like they felt so free, and that's what the goal is. It's supposed to be like very freeing type of engagement. And then these are just my references. So thank you.